billion in earnings over the next 20 years. Long before Katrina struck, the Louisiana legislature acknowledged the need to build a new teaching hospital. This project, in fact, originated under the Foster administration and received continued support from Governor Blanco after Charity Hospital was closed. And today, Governor Bobby Jindal and his administration have been dedicated to ensuring that the new University Medical Center meets its construction and financial goals. Representing the governor today is the Secretary of the Department of Health and Hospitals, Bruce Greenstein. Secretary Greenstein.
Thank you, and how great it is to see so many people here today. Listening to the Star Spangled Banner, I was ready to come out with a sports day, as I haven't been to many events where it hasn't been followed by some game. And I also haven't been to many events that the game that followed the Star Spangled Banner isn't something that we had won. So it's nice to be here with that kind of track record. I'm happy to share some thoughts with you today, because for me, having been here, come to Louisiana only 7 months ago, I'm involved with such an incredibly important project. And it's an incredibly important project for the future of our state and the future of the city. Hurricane Katrina was a terrible tragedy, and since that time, significant resources have been rightly devoted to the recovery. Today, though, our focus is not just on recovery. It's on the rediscovery of the city's incredible potential. When the first shovels turn dirt here today, do not see it as progress towards just rebuilding a hospital, but rather a step towards reinventing healthcare for all Louisianians and graduate medical education for our state's healthcare professionals. University Medical Center will be a world-class institution and serve all residents of the state. In our vision, it will compete on the national stage for the best residents, faculty, and researchers, invest in new equipment and technology, new lines of service, and cutting-edge research. Today is really a new beginning. We have much work ahead of us as we engage stakeholders and work with the board to develop a final plan for this world-class academic medical center that will train healthcare professionals to serve our state for generations to come. I am deeply committed to developing that vision and realizing it. What we build together will not stand alone. Through our partnerships with the VA and the medical schools, we are laying the foundation for a robust biomedical corridor in New Orleans, capable of attracting investment from across sectors, as well as national research funding and opportunities. We cannot underestimate the importance of this project. Those who just want to build old charity again without the vision of a center of excellence will have a short-sighted view of what the future of medicine will look like. Healthcare is changing rapidly around us. There's no better place to see this than right here in New Orleans. Born from the decimation of Katrina, a network of primary care clinics is serving as a medical home for hundreds of thousands of people here who would otherwise lack health insurance. As an administration, we worked hard to sustain that innovative model, despite funding streams that really incent more inpatient care. Those changes mean that charity, as we knew it, is becoming partially obsolete. It's time to move past that concept and take the opportunity right now to position Louisiana and this great city yet again as the driver of what 21st century medicine will look like. Our state and our country is facing a healthcare crisis, one of the most predictable of our times. In the future is our healthcare profession board. Consider this. In total, 86% of Louisiana's parishes are designated as health professional shortage areas. Nearly a quarter of our physician workforce is over the age of 60, and less than 20% of it is under the age of 40. And while our doctors are aging, so are the people they treat. By 2030, over a fifth of our state's population will be over the age of 65. Yet about 40% of Louisiana's medical school graduates are leaving our state for opportunities elsewhere. We must do a better job of attracting out-of-state students and residents to Louisiana and retain our own graduates here to address the growing problem. This kind of academic medical center that we're endeavoring on today will build on this site will necessarily confront this crisis. I want to thank Tulane President Scott Cowan, LSU President John Lombardi for their vision and partnership. The Memorandum of Understanding they signed lays the groundwork for this competitive enterprise, modeled after other great academic medical centers in this country. This model, built on a public-private partnership, gives UMC the flexibility to compete, as well as the responsibility to treat. The board has been seated according to the terms of that agreement and is invested in this vision. Its chairman, Bobby Arborough, has the business savvy and passion to pull it off. The tireless commitment of these men and women, along with Commissioner Rainwater's unwavering pursuit of what was rightly ours from the federal government, has brought us to this point. Remember, this is only the beginning, though. I also want to thank the mayor for his commitment and strong leadership in this area. Having joined this incredible team a relatively short time ago, I am just digging into this project. What I recognize immediately is that the bricks and mortar are really just one piece of the puzzle, and it's only the first piece. For me, I'm focused on what goes on inside of the hospital and eventually around the hospital as a hub of activity and business investment. I can assure you that we are carefully reviewing the data, and I am personally engaged in a fresh dialogue with all the stakeholders, not about whether to build the hospital or not, but what pieces make up the final reality that matches our collective vision of a world-class academic medical center. So when we stand here, in a few years from now, cutting the ribbon, we will definitely have delivered what you and the citizens of Louisiana both deserve and demand, and that will be a world-class academic medical center. Thank you.
Thank you, Mr. Secretary. The new University Medical Center is designed for our patients, incorporating many New Orleans design elements. Leading the design and construction have been Commissioner of Administration Paul Rainwater, along with Jerry Jones and his team from the State Office of Facilities, Planning and Control. They were joined by NBBJ Architects of Seattle, Glitch Kinnable Architects of New Orleans, Jacobs Engineering, and the new construction manager from Skanska MAP, represented today by Bill Fleming, the President and CEO of Skanska USA, and Michael Polito, the President and CEO of MAP Construction of Baton Rouge. Now it is my pleasure to call upon Commissioner Paul Rainwater. Commissioner.
Thank you, Bobby, and thank you everyone for allowing me to be here today. This is a great occasion. We're going to build a hospital. This is what we wanted to do for the last 5 years, and I will tell you that many of us have been involved in this process from the beginning, and I've been in different jobs and different times with different folks, and I just want to say thank you on behalf of the governor, to Mayor Mitch Landrieu, for all the hard work he's done, even as Lieutenant Governor, stepping up in many times and helping us negotiate with the federal government. Congressman Cedric Richmond, who is here, Dr. Cerise and Dr. Sachs for all their hard work that has gone into this day. I want to say thank you to the LSU Health Services staff for your dedication and hard work and your patience as you serve the citizens of this region while we negotiated with the federal government. I want to take just a few moments to talk about a little bit about that process, not to go back into the past very much, but I think it does warrant the fact that we're here. And people said we'd never be able to build this hospital, and people said we'd never get the money. Well, we did it. And there are a lot of folks here today who are involved in that process. But let's not forget that the federal government told us back in 2008 we'd only get $150 million. And the governor was given the option by a senior Secretary of Homeland Security official to either accept the $150 or not get anything at all. And so with the help of my former boss, Senator Mary Landrieu, who paved the way, like she usually does, with federal legislation, created an arbitration panel. And we were given the choice, either take the $150 or go to arbitration. Well, I will tell you that we had a good team of lawyers, and with the leadership of Jerry Jones, Facility Planning Control, who's always believed